It's hard to measure the impact that COVID-19 has had on our world in so many levels, especially when we focus on things like the medical care that we all receive. It's also forced doctors to make some very difficult decisions they could otherwise not have fathomed making when it comes to medical care, especially in the United States. But our 9 Health expert, Dr. Payal Kohli, is going to help us get into the minds of doctors facing the pandemic. Payal, it's been amazing to see and hear what goes on in places like New York right now and what decisions not only doctors but everyone who's coming face to face with COVID-19 patients are suddenly having to deal with and adapt to.
Yeah, Tom, it's been incredibly eye-opening. I actually spoke to a colleague of mine in New York earlier this morning, and what we're hearing is that you have patients lining the hallways, you have morgues that are overflowing in the hospital, and it really is a medical war. And during times of war, we threw out the rule book. So everything that we learned as doctors is now being turned on its head. We were always told about the healing power of touch and the importance of the physical exam. And now we're not even allowed to touch these patients. We were told to rely on diagnostic testing before making clinical decisions. We don't have those testing available in a fast enough fashion to make those decisions. And we were told to test our treatments before we give them to our patients, but now we're having to use treatments with very scant anecdotal data because of this virus. So it really has been completely, a paradigm shift for physicians and how they're managing in terms of what we've always been taught and what we're actually having to do because of this pandemic.
You always think of doing things by the book, and it used to be 20, 30 years ago, the book is where you learned how to do a lot of this stuff at first. Then there are journals like Journal of American Medicine, all these things that keep people up to date. But now I imagine day to day, hour to hour, there are updates on how people are managing COVID-19 patients from everything from Twitter to email, et cetera.
And that's the other interesting thing that's emerged is the connectedness that we had, which we didn't have with our pandemic in 1917, the Spanish flu, has really helped doctors to get through this. And it's really helped all of us to come to terms with that mentality shift because we're so used to doing things with the patient in mind. It's patient-centered care. But now we've had to put on our community hat and think about community-centered care because it's the greatest good for the greatest number. And sometimes that means difficult decisions like rationing ventilators and medications and some of the things the doctors in Europe had to grapple with.
Yeah, you even talk about rationing things like chemotherapy, which is hard to imagine that would ever take place.
Right. Yeah, absolutely.
So what do you think on National Doctors Day, your profession is being recognized? And we've seen these marvelous videos out of Atlanta and New York and other places where these ovations rain down from apartment buildings on people at shift change. I imagine for you there's a great sense of pride, but also empathy for your fellow healthcare workers.
Tom, you're so right. I mean, I think our doctors are doing what they do every day, and this pandemic has just brought it to light. But especially right now, give some love to your doctors because just think about a typical doctor's day. You're dressed head to toe in this personal protective gear. You're sweating. You can't even stop for a drink of water or a bathroom break because you're worried about contaminating yourself or you're worried about using up your PPE that you may not have access to again. Your hands are chapped and cracked, from all the hand washing. And then in the back of your mind, you're worried about your patient and you're worried about taking this illness home to your family members, to your friends, and of course to yourself. So it's the physical stresses, the psychological stresses that these heroes are dealing with. And I think they deal with them every day, but this pandemic has really brought them to an extreme and really helped, I think, the public to recognize just what doctors and all healthcare providers actually, what their days are made up of.
Yeah, I think people more now than ever have come to grips with what that is, and certainly this is the highest of stress that we've seen the medical community put under over, from coast to coast and around the world. Payal, it's always good to visit with you. Thanks for bringing us inside a little bit, and hopefully we'll see you again real soon. Thanks.